At this point in the pandemic, and yes, I say pandemic because we are still in a pandemic, more and more people who've never had COVID before are finally getting it. Those of us who've been lucky enough not to get infected are a dwindling number, so it was good and important to see President Biden getting the new updated bivalent booster that targets Omicron subvariants on camera on Tuesday, and he rightly urged Americans to do the same.
We're here with a simple message. Get vaccinated. Update your COVID vaccine. It's incredibly effective, but the truth is, not enough people are getting it.
Isn't it nice to have a president who prioritizes public health and pushes the importance of vaccination, who takes the pandemic seriously and doesn't try to wish it away? Oh, wait. If you'll recall, last month, President Biden also said this on 60 Minutes.
Mr. President, first Detroit Auto Show in 3 years.
Yeah.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape.
Here's the issue with that. You cannot, on the one hand, tell people that the pandemic is over when it's not, and proudly tout the fact that no one wears masks anymore, and then on the other hand, insist that people get a fourth shot. I mean, talk about mixed messaging. So is it any wonder then that less than 10% of eligible Americans have gotten their updated booster shot? Even for the original booster, not even half of eligible Americans have gotten it. Our booster rates are abysmally low when you compare them to other similar countries. Of course, vaccines on their own aren't enough, not to prevent infection for sure, which makes the Biden administration's vaccine absolutism, to quote one prominent epidemiologist, a strange and dangerous strategy. Vaccines do a very important job of preventing severe illness and death, but they don't stop long COVID, for example. And there's more than just COVID to worry about this coming winter. Cases of other respiratory illnesses are on the rise. CDC Director Rochelle Walensky tweeted about it last week, encouraging preventive actions to stop the spread of the flu, RSV, and COVID-19, like getting vaccinated, staying home if sick, and practicing good hand hygiene. Good hand hygiene. Didn't we learn months into the pandemic that that was not the way to prevent the spread of this airborne virus? That the best way, in fact, was to mask up in crowded indoor spaces? I mean, that's what healthcare professionals have overwhelmingly been saying. And yet the CDC quietly made the big decision in late September to loosen masking guidance in healthcare settings too, allowing workers there to choose not to wear masks in areas away from patients or where COVID levels are low. But a lot of doctors and hospitals are very unhappy with this. Many have decided to continue with their masking requirements, despite the CDC's strange and frankly dangerous decision. Perhaps that's why Walensky's tweet couldn't mention masking or ventilation. Her agency has decided against the science that masking need not be part of its winter flu season guidance. We don't need to talk about the airborne nature of this virus. I should point out that the evening of her tweet, Walensky, the head of the CDC, tested positive for COVID. We wish her well, of course, and hope she has a full recovery. Look, we were told this would be an administration that follows the science, and yet we have a CDC director sick with COVID, but telling people to wash their hands instead of mask up. We have a president telling people to get boosted, but also telling them the pandemic is over. Meanwhile, COVID, a constantly mutating, constantly spreading airborne illness that has killed over 1 million Americans and continues to disable thousands more, isn't going anywhere. Joining me now to discuss this is Dr. Stella Safo. She's a physician and founder of Just Equity for Health. We also have Dr. Ezekiel Emanuel, who was President Obama's White House health policy advisor and is currently the vice provost of the global initiatives at the University of Pennsylvania. Thank you both for joining me. Dr. Safo, let me start with you and ask straight off the bat. Cases are rising, not just with COVID. We have the flu, we have this respiratory virus, the RSV. Is this really the time for government health officials to be saying, no need for masks?
Absolutely not. I think that what you described is really the disconnect. You know, folks are being told that the pandemic is over. Folks are being told that they don't have to worry about masks, that they're safe. And then they're also being told, but be careful of this winter surge. Most people don't have the time to go through the public health kind of readings and the research behind this. They're just listening to the high levels. what they're hearing high level is that everyone's not wearing masks and COVID seems to be over, so I'm fine. And we're going to learn, unfortunately, the hard way, that we're not fine if we don't take some of these basic measures to keep each other safe.
Dr. Emanuel, you and other members of President Biden's advisory board on COVID-19, you wrote a pretty stinging op-ed for the New York Times this month about the Biden administration's COVID policies. You criticized them for not taking enough action on rapid, low-cost at-home testing, on improving indoor air quality, on the domestic production of masks and PPE, their poor response to long COVID, which never really gets talked about at the highest levels. The list goes on, as you point out in the op-ed. My question, is anyone in the White House paying attention to you and your colleagues?
Well, first of all, let's be fair. We were very critical of Congress for not appropriating money to improve the data systems, to continue the free vaccines, to also ensure that other systems like paid time off, so gig workers can actually take time off when they're sick, are in place. It's not just the administration that has dropped the ball here. Republicans have, and that is a very important message. The Republicans have basically stonewalled any systematic institutional improvements going forward. I do think that there are low-cost, basically free things that can be done, like establish indoor air quality standards and a grading system. Use the money that was appropriated to schools to make sure that all the indoor air quality in every classroom in the country is upgraded. We have the money to do those kind of things. We can also, as you point out, make sure that the testing regime we have, that people are comfortable testing at home, that those tests can include not just COVID, but RSV, influenza, and the other respiratory illnesses that we're really worried about. Those are things that can be done. They can be done with some cost, not a huge amount of cost. We also mentioned data systems related to wastewater. That gives us early signals. So we think there's a lot of initiatives that can be taken besides get the booster.
Agreed.
Which is a good idea.
Dr. Safar, let's talk about the booster, though, because our booster rates are pretty abysmal right now. And I just wonder what you make of this argument that a lot of liberals who say, well, look, we tried. Democrats tried. The Biden administration tried to get people vaccinated. They won't listen. They're Republicans. They're watching Fox. They believe in conspiracies. And I get that for people who don't want to get vaccinated at all. But that doesn't apply to the booster. By definition, people who are eligible for the booster have already had 2 shots. So they're not, COVID deniers. So surely they're persuadable. Why are we unable to persuade them?
And it comes back to what we've been saying about how we've minimized the impact and the potential spread of this virus so much that folks are deeply unaware. I had someone who provides childcare for us who tested positive for COVID. We did it at, rapid at-home test. And when she tested positive, we obviously said, take the time, get better. She didn't know what to do when she tested positive. She no longer knew, are we isolating? Are we not isolating? What are we doing? Young person just didn't have the information. And so if you think about this, she's not someone who doesn't want to take safety measures to make sure she doesn't spread the virus to others. She just doesn't have the information. So we're at a place now where it's actually a little bit different than where we were even a year ago, where there are folks who said, I will not vaccinate, even if, kingdom come, whatever, I will not vaccinate. This is different. We are in a place where ordinary people who would do what they should do to keep themselves and others safe are not hearing the messaging. They're not understanding the risks. And so they're walking around in crowded subways. Sat in a subway car yesterday. People are coughing and hacking. Most people aren't wearing a mask. How we got here is a failure on all of us. It's a failure certainly of our Republican counterparts, of Congress, of the White House, of us in public health. But ordinary people don't have the information they need in terms of the risk levels to make appropriate decisions. And we're all gonna suffer from that.
So,
and yet the New York authorities are putting out "you do you" on the metro. Dr. Emanuel, I've got to ask you one question.
Okay,
Dr. Emanuel, I've got to ask you this question. Go on. Yes, please go on. And then I'll ask you a quick question for that time.
There are 3 things we could do. One is, instead of waiting for people to come to us, we can go to people. They do this in other countries where they actually call up people and say, "Here's your appointment to get your vaccine," and we could do that too. The second thing is, we have millions of people in nursing homes and long-term care facilities like SNFs. We should make sure that all of them are vaccinated with the bivalent booster. And that's super important. And I think those are 2 of the things that can be done for
But
this.
Dr. Emanuel, I've got to ask, we're almost out of time, I've got to ask, you want to go to people, the White House has a playbook that's being reported on this week that talks about using Walgreens, DoorDash, Uber to get deliveries of, antiviral medicines to people. We don't have a national universal healthcare system in this country. Other countries don't rely on private companies to do this.
It's not, we could do it through the insurance companies. You could do it through doctors. And by the way, you could put a sticker on every at-home test that people have. Call this number if you test positive. That will give people the information and also offer them an opportunity to enroll in a trial of some medication that fights COVID to see if it works. We have not, and those are suggestions we made a long time ago. We have not implemented them. And again, I think these are important interventions that we have to deploy.